Good afternoon, everyone, and welcome to the June 2019 edition of the St. Lawrence County Chamber's Lunch and Learn webinar series. We're going to give everyone a few more minutes to join us, so please wait patiently as we allow them to join. The June 2019 edition of the St. Lawrence County Chamber's Lunch and Learn webinar series. My name is Mike Bisa, the Assistant Director at the Chamber, and your host for today's webinar. The Lunch and Learn educational series are made possible by the generous support of our sponsors, Clarkson University and St. Lawrence University. Before I introduce our presenter today, I want to run through a few items. First, your mics have been muted and your webcams have been disabled. If you have any questions throughout the presentation, feel free to type them into the chat window. We will answer all questions at the end of the presentation. Also, towards the end of the presentation, we'll put a link to our survey in the chat box. Please take a moment to complete the survey. We take your suggestions seriously and use this to help us plan our presenters for future webinars. Please also note that this session is being recorded and will be available online through our Member Center at slcchamber.org after the webinar. We keep the webinars to under an hour so you can get back to work. So without further ado, I'd like to introduce our presenter, Patricia Hogel, Cancer Prevention and Action Project Coordinator at the St. Lawrence County Health Initiative. She brings over 20 years of experience in the prevention field to this new project. Previously, Patricia tackled issues around drug prevention and addiction. She has a passion for helping people and the communities she serves live healthier lives through her work and community service. Today, Patricia will lead us in exploring the burden of cancer in the workplace and how employers can impact the health of their employees and save money by taking a few simple steps. Patricia, the floor is yours.
Thank you, Mike, and thank you everyone for joining. I'm just going to share my screen here, so give me a second. Can you see am I good?
Looks good.
Okay, great. So today I would like to talk about cancer prevention and what employers can do to help their employees prevent cancer. So the agenda today is going to look like, first we're going to just briefly talk about cancer in St. Lawrence County. Then we're going to talk about things that we can do to lower our risks of cancer, what employers can do to reduce the burden of cancer, and then we'll have time for some questions. So the first thing I'd like to talk about is how common cancer is. Cancer is the second leading cause of death in the United States, second only to heart disease. It can occur at any age, but is most often found in those people middle-aged and older. And as you can see from the screen, 1 out of 2 men and 1 out of 3 women will be diagnosed with cancer at some time in their lives. The number of people diagnosed with cancer has increased over the past 40 years. Most of this is due to an increase in the population and because people are living longer. The most common cancers in men are prostate, lung, and colon cancer. And the most common cancers in women are breast, lung, and colon cancer. The next slide is St. Lawrence County specific. So this is showing you all cancers, all newly diagnosed cancers in St. Lawrence County between the years 2011 and 2015. And what they did is they took each year's numbers and took an average, and this is the most current data available. And as you can see, overall, males and females in St. Lawrence County, new cases, 648. So even though there's been a lot of technology in screening and prevention work, we still have a little ways to go here. This next slide is just comparing the top 2 killers in the United States. But this again is St. Lawrence County specific. And so what this is showing is the number of cancers and the number of coronary heart disease in St. Lawrence County. So as you can see, cancer really is even though it's the second leading cause, it's very close to the coronary heart disease. So like I said before, cancer is the second leading cause of death in the United States. But there is good news because 40% of cancers can be prevented through lifestyle changes. It is usually not possible to know exactly why one person develops cancer and another doesn't, but research has shown that certain risk factors may increase a person's chances of developing cancer. And there are things that we can do today to help prevent, delay, or even stop the cancer process at all stages of life. And this 40% of cancers due to lifestyle factors is based on some research that the American Cancer Society has done. So keeping your body healthy can lower the chance that you will get cancer. And here are some suggestions that we can do in order to lower our risks. So the first one is the most common one that we hear is no tobacco use. So tobacco use directly causes 1 out of every 5 deaths in the United States. That includes smoking, chewing tobacco, and vaping. And the thing with vaping is right now, because it is so new, we really don't know the consequences that we'll see due to that. The second one is to maintain a healthy weight. There is consistent evidence that higher amounts of body fat are associated with increased risk of a number of cancers. So staying at a healthy weight throughout your life and avoiding excess weight gain can lower your risk of developing cancer. The next one is be physically active. Maintaining a healthy weight and getting regular exercise may help lower your chance of getting colorectal, breast, uterine, prostate, esophagus, kidney, and other cancers. And it is recommended that adults get at least 150 minutes of moderate intensity exercise each week, preferably spread throughout the week. The next one is to limit your alcohol intake. If you drink alcohol, drink only in moderation. The more alcohol a person drinks, the greater his or her chance of getting cancers such as mouth, throat, esophagus, liver, colorectal, and breast cancer. The American Cancer Society recommends that women who drink have no more than 1 drink a day and men have no more than 2 drinks a day. And that is considered a standard drink. So, you know, like a 12-ounce can of beer, a 1.5 shot, and 4-ounce glass of wine would be considered a standard drink. The next one is to protect your skin from the harmful rays of the sun, and this also includes tanning beds. Ultraviolet radiation is a major cause of all skin cancers, and melanoma is the deadliest form of skin cancer. Exposure to UV radiation from the sun or indoor tanning causes 90% of melanomas. The sun's UV radiation can cause damage to your skin, and too much time in the sun increases your skin cancer risk. some of the things that you can do to lower this risk is to limit your time in the sun, seek shade if you are out in the sun, apply broad spectrum UVA and UVB sunscreen of at least 15 SPF, and cover your skin with clothing, hats, and sunglasses. The next one is get your recommended vaccines. And this in particular is talking about the HPV vaccine. The HPV vaccine has been proven that it can prevent the infection caused by HPV from becoming cancer. And we're going to talk about that a little bit more later on in the webinar. But I do just want to say that the recommended ages for the vaccine is 11 to 12-year-olds. And then the last one, and this one is the one that we're really going to talk about for the rest of the time, is to get your recommended cancer screening. So cancer screenings. Cancer screenings is the process of looking for cancer or precancer in people who have no symptoms of the disease. Cervical and colorectal cancers can be prevented through screening. Cancer screenings can improve your workforce health. And we're going to talk about the recommendations for screenings for breast, cervical, and colorectal cancers. And this is from the United States Preventive Services Task Force. So for example, colorectal cancer screening rates are increasing. And because more people are getting screened, we're seeing less deaths in the United States from colorectal cancer. But there still is a lot of work to be done. According to the Centers for Disease Control, only about 68% of age-eligible New Yorkers had a current colorectal cancer screening. And screenings really are important because when you get screened, you can it will detect cancer at earlier stages, and it also, for certain cancers, will detect precancerous cells that can be taken care of before they turn into cancer. So it is very important that we take down barriers to screening, especially for colorectal, cervical, and breast cancers. So we're going to talk about breast cancers, or breast cancer. 1 in 8 women get breast cancer in their lifetime. And between 2011 and 2015, the average number of new breast cancer diagnoses for St. Lawrence County was 71. And during that same time period, the average deaths due to breast cancer in St. Lawrence County was 14. So what that means is 71 new cases every year and 14 deaths every year, just in St. Lawrence County alone. But a mammogram is really the best way to detect breast cancer early. Again, early enough where treatment could possibly be more successful. So it's really important that that women get their mammograms regularly. So according to the U.S. Prevention Services Task Force, the recommendations for a mammogram are women ages 50 to 74, 1 mammogram every 2 years. Now, that being said, if for some reason a mammogram may show something, they may recommend that you get your mammograms more often. And some women who are at higher risk may have to be screened before the age of 50. But it's really important that you talk to your doctor about when to start screening and how often to be screened. The next cancer that can be detected early and maybe even precancerous cells can be detected before they turn into cancerous cells is cervical cancer. And most cervical cancers are caused by the human papillomavirus or the HPV virus. HPV is a group of more than 150 related viruses, and there are two different categories of HPV virus. There's the low-risk HPVs, which can cause warts on or around the female and male genital organs and in the anal area. Low-risk HPVs are seldom linked to cancer. But there is another category which they call high-risk HPV, and these are strongly linked to cancers, including cancers of the cervix, vulva, and vagina in women, and penile cancer in men, and cancers of the anus, mouth, and throat in men and women. The HPV vaccine can help prevent the infection that can cause cancer in both boys and girls. And the recommended ages for vaccination is all boys and girls ages 11 to 14 years old should get vaccinated, which consists of 2 doses, 6 to 12 months apart. If for some reason you are not vaccinated at that age, you can be vaccinated for men up to the age of 21 and for girls and women up to the age of 26. Most invasive cervical cancers are found in women who have not had regular Pap tests, and screening tests check for precancerous cells that can be removed to prevent cancer. So when you have a Pap test or a Pap smear, what they're looking for are those changes in your cells, your cervix cells, that can detect whether there's something going on abnormally, which could lead to cancer. So the cervical cancer screening recommendations are women ages 21 to 29 years old should get a Pap test, or what they also call a Pap smear, every 3 years. And women 30 to 65 years have a choice. They can get the Pap test every 3 years, or an HPV test. HR stands for high risk. HPV test every 5 years, or a Pap test and an HPV test every 5 years. And what the HPV test is testing for is whether or not you have the HPV infection. Because again, most people get in their lifetime will have an HPV infection, and for the majority of those folks, it does clear on its own through the body immune system. But for some people, it doesn't, and it may end up turning more into precancerous cells, which will in turn turn into cancer. And then the next cancer that can be detected early and prevented through screening is the colorectal cancer. So colorectal cancer is the second leading cause of cancer among New Yorkers, and that's both in men and women. When polyps are found and removed, colon cancer can be prevented. So the polyps really are more a precancerous stage. And so when you get a colonoscopy, that's what the doctor is looking for, is those polyps. And you may know somebody that maybe talked about when they had a colonoscopy, polyps were found and the doctor removed them. Unfortunately, only about 1 in 3 people in the United States get tested for colorectal cancer. The American Cancer Society surveyed more than 2,000 unscreened adults to get a better idea of why people were not getting screened. And some of the reasons why they gave is because they heard the test is difficult or painful, and they may be embarrassed to discuss colorectal cancer screening with their doctor. Because they have no family history, they think they aren't at risk and don't have to be screened. They think screening is only for those who have symptoms and they are concerned about the complexity and cost of screening, including taking time off from work. The one thing I do want to mention about colorectal cancer is that it does not have, in the early stages of the cancer, it does not have any symptoms. So you may have it and not even know. But again, getting screened can detect those polyps before they turn into cancer. And if colon cancer is found and treated early, it can be cured. So the recommendations for the colorectal cancer screening is adults aged 50 to 75 years. High risk for colon cancer, you may have to begin screening earlier than the age of 50, and there are 3 types of tests. So the first test is the fecal immunochemical test, or what they call the FIT test. This should be done once a year if results are negative. And what this test is you'll get like a little kit, and there'll be 2 cards in there, and what you will do is take a stool sample. You'll take actually two stool samples. Wow, that was hard to say. And 24 hours apart, and you'll smear each sample on the cards, and then you'll send the cards in. And what that is looking for is blood in the stool, because blood in your stool is an indication of polyps and possibly cancer. So if you do this test and it comes out to be a positive, then you really should go on to the next step, which is a colonoscopy. And the colonoscopy is a test that they put in a scope up, and they look at your colon all the way through your colon. Colonoscopy should be done every 10 years. However, if polyps or cancers are found during the test, you will probably need more frequent colonoscopies in the future. And then the last test is the flexible sigmoidoscopy, or the FlexSig. This one is not really done too often in the United States. This is very similar to the colonoscopy, except they only look at the first 1/3 of your colon instead of really going up and looking at the whole thing. So as far as colon cancer, I just want to mention the 80% in every community. This is an initiative led by the American Cancer Society, the Centers for Disease Control and Prevention, and the National Colorectal Cancer Roundtable. And this is really, what they're trying to do is in every community, getting that percentage up from the 68% that we talked about earlier in New York State to 80%. So 80% of individuals getting screened for colorectal cancer. Now, we would rather have this be 100%, but right now they really are looking for the 80%. And so what a business can do to help with this is they can adopt an 80% corporate commitment and establish a company-wide goal for colorectal screening. So within your business, making a commitment to getting, just your little piece of the world, that your business, your employees, 80% of them that are eligible for colorectal cancer screening, getting that up to 80%. You can educate your employees on important facts about colorectal cancer and screening, and you can create a cancer screening friendly work culture by offering cancer screening paid time off. And then for more information, there is the website here. Or you can just Google 80% in every community. So cancer screenings really does save a company money. Cancer, like we said before, cancer is the top 5, I'm sorry, we didn't say this, but cancer is one of the top 5 most costly diseases in the United States. Diabetes, Alzheimer's, heart disease are some of the other ones. Cancer screenings can help detect cancer early when treatment can be most successful, or in some cases, prevent cancer from developing in the first place, which in turn means a healthier workforce. Cancer affects how well an employee works, and it affects not only the people with the disease, but their families, caregivers, employers, and entire communities. I think we all pretty much know someone that has been affected by cancer sometime in their life. But these numbers do not account for an employee taking care of a family member that has cancer. If we included this, I would assume that the cost would most certainly go up. So this next slide is going to, what it is doing is there was a study done by Mitchell and Bates in 2001, and what they did is they compared the average annual rates of absenteeism, or days of work missed because of illness, and presenteeism, days at work but limited in performing job tasks because of health, for a group of individuals with health conditions or health risks, and they compared them to individuals without the same health conditions or risks. And based on the answers to the survey, they calculated the average cost. The average calculated cost of productivity loss, including both absenteeism and presenteeism, were higher for those with conditions and those at high risk for health problems compared with matched groups. And as you can see from the chart, cancer was the most costly. So cancer, according to these researchers, cancer can cost an employer an extra $1,601 over someone that does not have cancer. And some of the barriers to employees getting cancer screenings: employees do not have enough paid sick time. Employees are afraid to use their sick time for preventative care if they need it for an illness. And one of the things that happens is, because a lot of the cancers do not have symptoms, people don't think that they're sick, so they put the screenings aside for more important illness or whatever. And a lot of times appointments are only available during traditional office hours, and employees are not able to leave work. So what is paid time off for cancer screenings? Paid time off for cancer screenings is an extra benefit to your employees. It is granted to them specifically to obtain recommended cancer screening. This is not the same as sick, vacation, or personal leave. Paid time off not only breaks down some of the barriers that employees face, but companies with a paid time off for cancer screening puts individuals first, and it sends a message to everyone that getting recommended screenings is important. And New York State has passed a law that all public employees are provided up to 4 hours of paid time off for cancer screenings per year. And that is for all cancer screenings. So that not only includes the breast, cervical, and colorectal screenings, but it also could include something like skin cancer screenings, or like a lung cancer screening if the employee needed that. And these can look like really anything that the employer would like it to look like. So some folks have 4 hours for just the breast cancer, the cervical, and colorectal cancer screenings. Others have expanded that to be all cancer screenings. It really just depends on what the employer would like it to look like. So it's important because, again, like we said earlier, it really does alleviate those barriers to cancer screening. It allows that person to use time other than their sick time or their other PTO time to really have that ability to go and get those screenings. It prevents an employee from having to choose between a potentially life-saving screening and a paycheck, and that's especially true for those employees that may not have any sick time. And research has shown that paid time off increases employee screening rates, and it just really makes good business sense. Okay. So this here is just kind of showing the moving parts on what employers can do to help improve the health of their employees when it comes to cancer. So like we said at the very beginning, those lifestyle changes that can prevent some cancers. So you could really just encourage employees to kind of adopt those healthy habits. And some of the ways that you could do that as an employer is to provide healthy snacks at meetings and trainings, encourage physical activity, for example, have a walking group, provide information on how to quit tobacco, and just really encourage those healthy habits. You can offer educational materials such as e-blasts, posters, staff meeting presentations on cancer prevention topics. And you can adopt a paid time off for screening policy. So cancer prevention and action can help. We can provide information about the importance of cancer screenings for employees. For example, we could put something in your newsletter. We could offer you brochures, infographics, posters, etc., whatever it is that you might want in order to kind of help spread the word about the importance of those cancer screenings and what the recommendations are. We can help you with writing and promoting your paid time off policy, and we can offer presentations to staff on cancer topics. So in summary, cancer is a very common disease. It is the second leading cause of death in men and women in New York State. About 40% of cancers can be prevented at all stages of life through lifestyle changes. Screenings can find precancerous cells that can be removed before they become cancer. And screenings can also detect cancer early, which improves chances for successful treatment. Research has shown that paid time off increases employees getting recommended cancer screenings, and offering paid time off for cancer screenings can save lives and save your company money. So here are just some resources. So the New York State Department of Health has some really good cancer information and cancer screening information on their website. The Centers for Disease Control and Prevention also has some really good information. And then again, just the National Colorectal Cancer Roundtable, the 80% in every community. And so this is the time, I guess I'll answer some questions.
Yeah, thank you, Patricia. That was very interesting. We'll wait for some questions to come in. And while we do, I just had a quick question. How do we get in contact with you and your organization to learn more about, the offers that you extended to us, whether it's a image in our bulletin or maybe training in-house? Who would we contact for that?
Yeah, so you could contact me, and I do have my contact information here. So you can call the Health Initiative. My extension, the number is 315-261-4760, extension 235. Or you can email me at at gethealthyslc.org.
Great. We have one question for you. Could you provide or share any examples of paid time off policies for screenings? We have discussed this in our organization, but have not advanced it due to union contract constraints.
Yeah, so I absolutely could share that information with anyone who wants it. And that's one thing that this program can also do is help work with the unions or whoever in writing those policies.
Okay, so I will just put your email address into the chat window and they can follow up with you.
And I would be more than happy to meet with anybody too, if they want to sit down and just find out more about this or how it works. I'm always willing to have a meeting or a chat.
Sounds good. I'm just waiting to see if we have any more questions from the audience. Just want to make note that I put a link into the chat window. If you could please take the survey, we'll use that information to plan our future webinars. And I guess with that, we'll wrap up. I want to thank you all for joining us today. I hope you found this hour was valuable to you and provided insight on how you can take better care of employees' health in the workplace. Thank you, Patricia, for your time and sharing your expertise with us today. We really appreciate that and learned a lot. I'd also like to thank Clarkson University and St. Lawrence University for their support in sponsoring this webinar series. Just another note that all of our webinars are available online at slcchamber.org, and you can view the past webinars by clicking Archived Webinars in the right-hand menu. Next month, we will take a break on the webinars, but we encourage you to join us for a workshop hosted by the Center for Businesses in Transition that will feature a panel of local business owners who have transitioned their business using a generational model, employee ownership, or other creative solution. You can find more details on the workshop scheduled for Wednesday, July 10th at 8 a.m. at Anchor Space in Potsdam. Just check out our website at slcchamber.org for more information. And with that, I will let everyone go. Have a great afternoon, and thanks again, Patricia.
Thank you.